My name is Darshan Patel, and I'm a urologist and a men's health expert here at UC San Diego Health. My practice solely deals with men's urologic health issues such as male infertility, erectile dysfunction, Peyronie's disease, low testosterone, and enlarged prostate. I chose urology and specifically men's health primarily because of the opportunity to really connect with patients about sensitive issues such as erectile dysfunction or male infertility. It really takes a lot for someone to bring up those issues and really take charge and kind of get on the right path to better health and wellness. And for me, it's really rewarding to be part of that journey. I would say that for guys that are thinking about, coming in to see us regarding some of these issues, doing some of your own independent research is always nice, but ultimately you want to come to somewhere that has the experience to kind of give you various treatment options and not keep you limited in what's available. For a lot of the complex erectile dysfunction and Peyronie's disease, volume really matters, and for most general urologists, they don't see enough of those cases throughout the year to feel comfortable with a lot of the medical and surgical management. By coming to UC San Diego Health, you have kind of a team of providers that have a huge amount of expertise and experience in a lot of these conditions. We definitely have a spirit of collaboration. For men's health, that's really important because we work closely with internal medicine doctors, family medicine doctors, or other primary care doctors, cardiology, sex therapy, and then obviously reproductive endocrinology. So there's definitely kind of a multidisciplinary approach to the way that we treat our patients and really get the opinions of all our colleagues when we're dealing with difficult cases. I'm involved in the teaching of medical students, residents, and fellows, and I think that's really a rewarding part of my job as well. In terms of kind of patient care, it definitely creates an environment where there's always questioning or challenging of the norm, and I think that really drives new discoveries and new techniques that we can help patients.